Welcome to the panel. I am Ralph Lewis, publisher of the Caymanian Times newspaper. The very special guest on the program tonight is the Honorable Deputy Governor, Frans Manderson. Mr. Manderson will talk us through the systems and processes in place to guide Cayman through a successful reopening of the borders, which took effect last Saturday, November 20th. There has been much debate surrounding this, ranging from whatever the measures in place go far enough to if they are too stringent. Another issue is whether more attention needs to be placed on how we function within the borders once they're opened. That is compared to the protocols for being allowed to enter Cayman, including the vaccination and quarantine requirements. Should there be one person or agency assigned to coordinate this? Several other countries in the Caribbean and elsewhere have opened before Cayman, only to be forced back into tough restrictions or even lockdown as cases have spiked. What is Cayman doing to avoid such a situation and to reopen safely? Cayman is currently experiencing a rate of infections in most cases comparatively higher than most other Caribbean islands. However, the vaccination rate continues to be among the highest in the world, and deaths and serious hospitalizations are thankfully still very low. The government has been urging residents to be calm and to act responsibly by observing the existing guidance on mask wearing, hand hygiene, and social distancing. Much is riding on what happens after November 20th, which is phase 4 of the reopening plan. The economy depends on it, but safeguarding public health is even more important. I'm joined this evening on the panel by our analyst, Roy Button, and to discuss the reopening with the Honorable Deputy Governor, Mr. Manderson. Mr. Manderson, Mr. Button, welcome to the panel.
Thank you for having me.
Good evening. Great to be back.
Good evening to everyone, and how happy Thanksgiving, American Thanksgiving.
Yes, that's correct. Okay, Deputy Governor, please elaborate on the preparations that have been put in place so far.
Thank you. So Cayman has had the luxury, as you said in your intro. Other countries have opened up and then have had to shut down. Cayman has had the luxury of time because of the state of our finances, where we have had many years of $100 million surpluses. We have had money in the bank for that rainy day, and COVID was that rainy day for us. And because we had solid finances, because of our fiscal responsibility and the way in which we have been managing our budgets for many years now, we were able to not rush to reopen as other countries had to do, simply because they could not afford to stay closed. So by us being able to take our time and push our vaccination program to ensure that we had the highest vaccination rate possible. We set a target of 80% very early on. Many people did not believe that we were going to reach that 80%. Right. Truthfully, I had some of my doubts as well as to whether we were going to reach that magical number where, not many countries have been able to achieve it. And even today, not many countries have been able to achieve it. But the Caymanian people, our communities, did not let us down. And the government really pushed hard. We had the cooperation of the private sector, pushing hard to get everyone vaccinated. And now we have reached that magical number. So the first key to our success had to be high vaccination rates. It was very clear to us that while the vaccine did not stop you from getting COVID, it kept you out of the hospital and kept you from death. That was one of the benefits of the vaccine, and we are seeing that today, where I think as high as 87% of the persons who are in hospital are unvaccinated. So if there was any doubt about whether the vaccine was working, it's now. You can see it for yourself. Also, we wanted to make sure that we learned lessons. So we talked to our neighbors, we talked to other persons, we talked to the private sector, we talked to persons who have been traveling all over the world, to listen to them Because if we did not need, if it wasn't needed for us to reinvent the wheel, then why do it? So if a country had put a system, a policy, a procedure in place and it was working and we could Caymanize it, we did. So the government asked us to put in place a very comprehensive critical preparedness, readiness, and response plan. And it was my job as head of the civil service to chair the program board, which is made up of senior civil servants across the entire senior civil servants and public servants across our entire public sector. It has been one of the greatest pleasures and privileges of my time as deputy governor to chair that board, to see the passion, to see the dedication, to see the care of our public servants, all working together for one common cause, and that is to put a plan in place that would keep our people safe, reduce infections, reduce deaths, reduce persons from getting seriously sick. There were no silo working. You hear sometimes about silos in our civil service.
Yes.
They were broken down and everyone worked together. So we looked at across the entire public service, what were the key categories that we were going to have to look at to make sure that we were ready. So we identified healthcare. I see Ms. Yearwood is on the call with us. Ms. Yearwood has been critical, absolutely critical to our success. Her leadership at HSA has been absolutely instrumental in getting us where we are today, because our healthcare systems had to be robust. It had to withstand what's happening right now, where people are getting infected, people are going to the hospital. She had to ensure that her team was ready for a surge. Her team was ready with oxygen. Her team had the latest drugs. Her team was resilient. All of those things had to be put in place. We could not wait until today to start to think about those plans. We are nearing completion of our field hospital, so that if there is a surge that the HSA cannot manage, we will have, I think, almost 80 beds available for where persons can go and be treated. And Ms. Yearwood has also recruited additional staff. It doesn't make sense to have a field hospital and no staff. So all of those things had to be put in place to ensure that we were ready. Public health. Did we have enough people in place to deal with contact tracing, to do the testing, to do all the things that are necessary to ensure that we are keeping ahead of COVID? We had to have a national framework and critical preparedness plan. So we have to have a plan that says, if we get to certain levels of infections or hospital rates, there is some new measures that we can look at. So we have those things in place as well. Our continuity of essential services. How are we making sure that our police, our CBC, our prison, all of the key essential services that we provide will be able to continue their operations? So we've had to put plans in place to make sure that our prison, we could keep COVID out of prison. We have not been 100% successful, but they had a plan to make sure that we did not have wide infections in the prison. So they have that plan in place that it mitigates against widespread infections in our prison. We also want to make sure that our lateral flow policy was robust. So before you were in contact with someone who tested positive, you went home for 10 days or 14 days, depending on your vaccination status. That is no longer the case. So someone can have their child that is positive, but they can take a lateral flow test every day and go to work. That ensures that our services, our public services, our banks, our law firms, all of those companies can continue to operate and don't have all of their staff at home. We had to look at employment and labor, making sure that we had the necessary systems in place to ensure that our people, when the borders opened, were getting the jobs that were absolutely going to be available. We want to make sure, but we also recognize that there will be some jobs that we can't, there are not enough Caymanians to do. So we had to have systems in place. So when there was absolutely no Caymanians available, that we could grant work permits if they were justified. So making sure we had those policies and procedures in place. And also at the border, make sure that we have everything in place there to give the passengers a good experience coming into Cayman for the first time. We have that pent-up demand. People want to come back to Cayman. We want to have the band playing. We want to have a very smooth passage through our controls so that people understand that we have done everything possible to keep them safe. So the pre-arrival PCR testing, the testing on day 2 and day 4 and day 10, or 2, 5, and 10. I can't remember which one right now. But it's those things that we have to put in place to make sure that the infection rate in Cayman is kept under control. And to do that, we had to develop our national lateral flow policy, a lateral flow policy for the workplace, a lateral flow policy for our hotels. All of those things had to be put in place to ensure that we were ready and able to respond. We did not want to play catch up. We didn't want to see something happen that we had not really thought through and said, if this happens, how are we going to deal with it? So we tested a lot of our systems to make sure that they were robust. Are they perfect? No. Are we having to do various tweaks? Yes. But we will accept that we have to do various tweaks. What we won't accept is that the systems are good. We need them to be great. Our people are depending on us. Our government are depending on us to make sure that we have strong, robust, efficient, and effective systems in place to keep our people safe. Education was paramount. We had a lateral flow policy for our schools. We've had to purchase over 1 million test kits to ensure that our teachers can keep teaching, our students can stay in schools. We're not having to shut down the school, shut down a classroom. Having that lateral flow policy has been a game changer for us in our schools. We had to look at travel and border control. As I spoke of earlier, having our systems in place at the airport is absolutely critical. Data and analytics. So we needed data that you see coming out every day from public health, advising the public what our rate of infections are. No matter how high those numbers go, we need to be able to respond quickly and get that information out to the public, get it to our elected leaders so they know what to do, what new systems or new policies that they need to be put in place. So to make sure that we can respond. We also had a local modeling team that we were very, very proud of that gave us models on what to look for in terms of infection rates, hospital rates, and even deaths. We had that complemented from the UK as well, where they also provided us with some modeling information. And then last but not least is our communications. We have to educate the public. We have to drill the information into them in terms of here is what you need to do to keep yourself safe, your family safe. Here are the various policies and procedures that are needed to ensure that you are complying. Because the key to our success won't necessarily be our policies and procedures. It will be compliance. So every country in the world can have the very best policies and procedures in place to keep their people safe. But if the community does not respect those policies and procedures, if they don't follow them, we will have a problem. And that is where our communication comes in and giving our people the very, very best advice and information that is needed in order to keep our infection rates down, keep people out of hospitals, and keep us from shutting down. And what you're doing tonight is very important. So I thank you for having me on and giving me this opportunity to talk a little bit about what we've been doing over the last many months.
And thank you very much for those brief words and things that you spoke about. And yes, the panel has been designed especially now to help educate from independent source, talk with the right people, and support the message, because I think the message is so key. Like you rightly said, you can have all the policies in the world, but if you don't have people following them, it's not going to work. And we need it to work. Roy, you want to add anything at this time?
No, except that I have a couple points that I would wish to seek clarification upon.
Sure.
So the first has to do with opening up and the hospitality industry. I said before, Mr. Manderson, that I was disappointed that the hospitality industry didn't use the interregnum between the lockdown and now that we're opening up to do some sort of training and preparation for Caymanian people who are either returning to the hospitality industry or who were new and wanted to come in. And I remain to be convinced that was handled effectively, because I haven't heard, I'm not saying there were not any, but I have not heard of any formal training or orientation on any significant level during that period. What a lost opportunity, because what we cannot afford to happen is to get back to the same old state where employers claim they have to have an increase in work permits because there are not enough available Caymanians, or that the Caymanians are not trained.
Yes.
So that's one concern I have.
And sir, that is a real concern. It is a concern shared by Cabinet. We have had those conversations on a number of occasions. Ministers feel very strongly about it. Certainly, as the former head of immigration, I have a great connection to all of this, and I understand exactly what you're saying, and you're preaching to the converted here now. We have to ensure, and I must say, there have been jobs fairs, there's been training programs. Our Department of Tourism has worked with the CETA. CETA has done some work as well in terms of getting people in, training them up. Their feedback has been, we can only do so much training on empty beds. We need people in beds, we need people in the rooms, we need people to be there for us to complete the training. I'm not sure about that, but that is what they have said to us. But the mandate of the government is very clear. We should not, and the law says this very clearly, issue any work permits until we are absolutely sure that there is not a Caymanian qualified and able to take up that job. We have been saying this for months in terms of train our people, give them opportunities, and now the time is for action, because we need to see those persons in jobs. The government is spending a little more than $5 million of our money every month to sustain those persons who have lost their jobs during COVID. That is not sustainable. For the government to take that into the new budget year is going to mean other programs and services is going to get impacted. Our Deputy Premier, our Minister of Tourism have real concerns about these areas. In particular, all members of Cabinet, but both of those have been very vocal about ensuring that our people get every opportunity. The Deputy Premier is responsible for work. Minister Bryan is responsible for tourism. So they have taken their responsibilities very seriously and is doing everything possible to ensure that our people, if they're not in jobs now, that they should be and will be, if we're going to open up with that type of Caymanian kind, systems and that warmth hospitality that our tourists deserve.
I take your word for it, sir, and I hope that I'm not disappointed. But I will say this, that I am prepared on the panel or otherwise to call out any lost opportunity or any attempt to slight Caymanians,
Yes, sir.
if and when it occurs. I would hope that I don't have to resort to that, but I'm very concerned. The second point has to do with frontline people, namely taxi drivers. Now, I noticed that early in the new year, cruise ships will be coming in, but over and beyond that, because I don't know how much, tourists take the buses and stuff to the beach and all that. So in terms of protection of frontline workers, particularly taxi drivers, our cabs here don't have any separation between driver and passenger, as cabs have in some other jurisdictions, like a plexiglass. How are we going to guarantee that there is no transmission, that we are able to keep a safe atmosphere inside these vehicles and protect both driver and passenger?
Yeah.
What are the
Thank you, Mr.
protocols?
Barton. It's a very good question. The good news is, for the last 5 or 6 months, we have been using our taxi operators to transport persons from quarantine to be testing. That means that and from the hotel, from the airport to their quarantine at residence locations. So we have been using our taxi drivers for many, many months now. What that means is that they have transported COVID positive patients to get tested. They've taken COVID positive persons probably from the airport to their homes. And I am not aware of any of those persons contracting COVID, mainly because we have very, very robust policies in place to ensure, sanitation policies and procedures in place to protect them. So they are always wearing their PPE. They have been advised of the distance to keep people away. You have people, moving up into the front seat to talk with you, to keep those distance, to sanitize and disinfect your cab after each passenger. There was a time when we used to tell the taxi drivers, do not take money. The government is paying for these taxi rides from airport to the persons, from the airport to their quarantine location. And we did that because we didn't want money to be passed by. But then I was told, well, Deputy Governor, I don't know why you're doing this, because the people are giving us tips and we are collecting it. And I take the tip and I put it by the in the sun, and I spray it with Lysol, and I wait a while, and I'm okay. So the good news, Mr. Barton, is that we have been doing this now for many, many months. Our taxi drivers, our buses, and other entities have been transporting these persons, and they've been doing it very safely, mainly because of the sanitation protocols that we have put in place. And they have been working with us shoulder to shoulder to ensure that they are keeping themselves and their families safe.
I take note of that. But now, what I want to be assured of is that in the excitement, since we both know when the numbers come, that those protocols are going to be abided by and are going to be meticulously followed. So here's my next question now. From the dispatch points, like airport, are there any persons whose responsibility it is to see that at the point of picking up those passengers, at the very least, that those protocols are abided? Because you won't be able to monitor each individual driver, but certainly at the point where they depart from the airport, if are there going to be any persons there whose responsibility it is to see that the protocols in terms of receiving the passengers and dealing with them are established? Or are you leaving that to the individual taxi drivers?
Yeah, no, sir. So we have, you would have seen that we have put in a ticketing system. We had that during the lockdown, where our police and were allowed to go to restaurants, go to different locations, look at taxis, look at other places to see where they were actually following the guidelines. And if they don't, if they're not, and they're found to be in breach of those guidelines, then we can issue them with a ticket. So they're going to be enforcement. There is enforcement. Again, sir, is it as robust as we need it to be right now? I think yes. However, when we have, many thousands of visitors coming in, it will be a challenge, but we will rise to that challenge. So we have always had the ability to rise to the challenge, whether it is diversing resources, training up other persons to take on these responsibilities. We can't ask our police to be everywhere. So we're looking at how, who else can help out in that regard. Is it Travel Cayman, who've had lots of experience monitoring persons in quarantine, going out, doing door knocks, being the boots on the ground, checking people to make sure that they're complying with our isolation protocols. So we have a team of young Caymanians who has been doing this job for quite a long time who can assist in this regard. But you're right, sir. It doesn't make sense to have a policy if there's no enforcement, and we take that very seriously.
Okay. I have a few things I would like to say, and that's the first questions, Mr. Madison. I'm a very optimistic person, and I think people take their health and wellness very well. One of the times people get upset and nervous is when they're sick. So they're afraid to go to doctors. And I believe that once they understand what's at risk here, they will fall in line. There may be the few that will just be, complacent, but the majority, and from my experience and talking to many of our listeners, they are serious about doing the right thing. And that's why they have so many questions, want to make sure what the right thing is. And so with that in mind, can you just explain the procedure when you're traveling overseas and when you return to the Cayman Islands, just to clarify a few procedures there for our travelers?
Sure. So the first thing is that you go onto our Travel Cayman portal and you answer some questions, you scan in your vaccination certificate, and you tell us, where you don't have to tell us exactly when you're coming in, but you have to tell us that you are coming, and that you are. We want you to do it about maybe 10 days before, and the certificate is good for valid for 3 months. So we're not tying you down to a particular flights after once you get in. So we have set up a system that is the only system in the world where our behind the scenes IT system can read the QR code from the HSA's QR code and other QR codes as well. So once you have a HSA vaccination certificate, and we can securely verify it on the other networks that are used in the United States and some other areas, then you will get your travel authorization in seconds, not days or weeks, in seconds. And because it will be securely verified behind the scenes. That's number one. If you have a vaccination certificate that cannot be securely verified by the QR code, you would upload that in the system and you would send that to us. We will then do a manual verification behind the scenes, and in a normal day or two, we will send you back your travel authorization. So once you've had your travel authorization, now remember, only persons who have been vaccinated are able to come into the Cayman Islands right now, unless you are a Caymanian, a resident or a family member of a resident or a Caymanian. You are not allowed to come into the Cayman Islands. You if you're a tourist, you have to be vaccinated. Everyone who is a tourist has to be vaccinated. So before, up to 72 hours before you arrive, you go and do your PCR test. It must show that you're negative. You go to the airport, you show them your travel declaration, you show them that you have your negative PCR test, and you jump on the plane and you come on down to the beautiful Cayman Islands. At the airport, we'll go through some further checks. We wanted to verify some of the things that you have. We will look at your your QR your travel authorization. We will look at your negative PCR test, and then it's smooth travel through our controls. And if you are going to a hotel, there's a taxi outside waiting for you. If you're going home, there's a taxi outside waiting for you. If you are going to a government quarantine facility, for example, then we will take you there, escorted. If you're having to isolate because you're unvaccinated, then that is something that we will control through Travel Cayman, and the protocols I discussed earlier would be in place to ensure that the person is taken from the airport to one of the government quarantine facilities. And again, that has been working very well. So that is the procedure. Now, there's one thing that I would like to emphasize here this evening. Talking to my colleagues in TCI and in Bermuda, I asked them, what happened when you opened to tourists? Did you see a rise in your infection rates? And their answer was, yes, there was some rise, but COVID got into our homes, rest homes, and other areas, not because of tourists, but because of our residents, our people going away, coming back, and not taking the necessary precautions. So my message is, the days of us going away and coming back and going to look for mama and grandmother are over. You're going to have to wait. You're going to have to do your day 2 and day 5, or day 2, day 4, day 10 lateral flow test. Make sure that you are COVID free before you go and visit your family, the elderly, the vulnerable, because you could be infecting them. And none of us would want to be responsible for infecting our loved ones. You want to bring them gifts. I'm sure you brought them gifts from overseas. You want to just surprise them. It's their birthday, it's Christmas coming up, but we need to be responsible, and we need to ensure that us as Caymanians, as residents, are not bringing COVID back into our communities. For example, my mother, the chance of my mother ever coming in contact with a tourist is very slim. My mother has she goes to her Bible study, she goes to Foster's in West Bay, she goes to church. The chances of her meeting a tourist and getting infected is very slim. But if I go away and I come back and I run to her house, as I always do when I travel and go and see her, then that could be the reason that she get infected. So it is something that we must take very seriously and ensure that we act responsibly.
I support what you said, and I emphasize it is so important. And we know that most of our travelers in the next couple of weeks will be residents who are going away. Some of them right now doing their regular shopping for Christmas. And so, in the next couple of weeks, we expect the same come back, and hopefully we would not have those increasing cases. Is there a piece?
And sir, I just want to finish, and that is why we have put in place those lateral flow tests over a period of time, and to ensure that they're monitored. So on day 2, you go to a licensed physician, and they will take the test for you, and we have a very easy system of it being reported in to public health so that we can monitor those things as well. So we want to monitor you over a period of time, up to 10 days. Yes. To make sure that you're COVID negative. And after you have been done those tests, by all means, go and see your loved ones, but take every precaution.
My next question is regarding the resources. And as you're the most important, or you're the head of the most important group of workers in the Caribbean, largest task, so not the Caribbean, the Cayman Islands, the largest task force. How are they managing their other roles by being on the program boards and doing all these other things? There must be some shortage somewhere, or there must be some lacking in some other duties. Is that going to impact the other services that the government is required to perform?
That's right. Mr. Lewis, you're so right. What we have is some very tired individuals. Persons have been working literally night and day, nonstop, to develop our response plan and to get us to where we are today. It was a lot easier when we were locked down because a lot of your day-to-day activities had stopped. So you were not getting customers in, your email traffic was down, there was not a lot of applications coming in, things had slowed down. So when we were operating our NEOC, our National Emergency Operations Center, we could easily redeploy civil servants to go and work in hotels and go and work in other areas. When we reopened the economy, well, then everyone had to go back to work. So we then needed to set up the Travel Cayman. That didn't exist before. So we were able, and I know Mr. Bawden would like this, we have been able to recruit about 100 Caymanians who were unemployed and put them to work in Travel Cayman. And I visit there often, and to see our young people, many of them are very young, but were out of work and have done an absolute amazing job for us. It just shows that if you give Caymanians opportunities, they will respond. And Travel Cayman has been that shining star for us in terms of retraining our people to do different jobs. So the program board we have had to multitask. One of the things that I did early on as deputy governor, which has paid huge dividends, was to set up our strategic reforms and implementation unit that is headed up by Ms. Mary Rodriguez. That unit job was civil service reform and looking at how we could put various programs and procedures in place. They did a lot of training on business case development. But I've just basically called Ms. Rodriguez and said, we need to develop a reopening plan. I need you to lead it. And we had a good team of dedicated professionals there who were able to answer that call. So that unit was driving, but of course, they needed a lot of other drivers as well. So I give my hat off and I thank my team every day from the program board of giving up their time, their weekends, many nights, multitasking, chief officers who have very large ministries, being able to multitask and develop the very detailed COVID policies that we had put in place. It has been exemplary how they have worked time away from their families, but the government asked us to deliver probably the most important project that this civil service have ever been asked to deliver, a plan that would reduce our hospitalizations, reduce the deaths, and keep our people safe. And they have responded. And it has been a really shining moment for us in the civil service and the wider public service, a great team effort.
Thank you, Mr. Manderson.
Mr. Manderson,
Mr. Roy.
Was there any collaboration with the private sector? And to what extent was that collaboration? And even now, does the various entities, are they aware of the roles and responsibilities they have to make the opening up a success? Because the government, oftentimes we say, oh, the government is responsible for this. The government should do this and the government should do that. But we're at a time now where the government cannot do it alone, where the government needs the support and the cooperation, particularly of the private sector, and especially those elements in the private sector which are in the hospitality business. So I want to find out to what extent was there collaboration between these entities and the government, and if that collaboration and cooperation is ongoing.
Yes. So the good news is, the answer to that is yes, there has been collaboration with the private sector from the day that we shut down. I chaired our NEOC, like I said, the National Emergency Operations Center, and the private sector was there with us then. The Chamber of Commerce, various private sector entities, doctors, the hospitals, different areas were with us then, and they have been with us throughout. One of the major areas that they have helped to play a key part in is our lateral flow policy for the hotels. So we've had to have various meetings with our CETA and the wider tourism body to ensure that they understood, first of all, the need for us to have a lateral flow policy for travelers. Then we also needed our private sector physicians to be part of that as well, to agree for travelers to come to their offices and get tested. And we had excellent cooperation. Many private sector doctors, offices have come forward and want to be part of the solution. We have gotten great cooperation from our hoteliers and other areas. Now, they have been on us from day one. You all need to open now. They put a lot of pressure on us. They wanted us to open a long time ago, but we were not going to be pushed to reopen before we knew we were ready. So we've had great cooperation. They've given us lots of ideas. That, we've had persons who have traveled all over the world in the last few months. They've come back. They've shared their experiences with us. I get tons of emails from persons saying, "Try this, do that," and we take those on into consideration whenever we are putting our policies in place. But I have no real complaints about the private sector, and they're helping us. Organizations like ARC and Feed Our Future and all of those other charities, the Red Cross, our regiment, all of those entities have been very, very instrumental in our reopening safely.
Sounds good. Sounds good indeed.
Yes, I have a question regarding health services, and Lizette is on. That's good. Maybe she may be able to come in and provide some answers. Could you explain the difference between the CMO and Lizette's role?
Whose role?
Chief Medical Officer and Ms. Yearwood's role.
So the chief and I'm not sure we want to put Ms. Lizette to work, but I'm sure she can add, or if I get it wrong, she can let me know. But the CMO is government's principal medical advisor. So he sits in the Ministry of Health, and he advises the government on basically medical strategies and policies, all those things. And Ms. Yearwood and the team, she is in charge of the hospital. So she oversees everything that happens at the hospital and keeps that running efficiently and effectively. And like I said, she's been doing an outstanding job.
You mentioned that the resources are being put in place at that level to make sure that when someone does get sick, if they do, and they move into the facility, that there's enough nurses. I'm always talking about resources, and being burnt out is one thing to have a nice ICU unit, but do we have the staff? And what's the comfort level within staffing and the response to the staffing and that she's getting?
Yeah. So Ms. Yearwood told us about this very early on, and she did not mix her words in that I am having seriously difficulties recruiting nurses and other healthcare professionals, because why? They were in high demand all over the world. Yes. So it has taken us quite a bit of time to locate these persons, get them in. We have recruited people on island that had these expertise that may not have been working in those particular areas. But I am pleased to say that just I think this week there were 20 persons that have been successful. 10 persons are scheduled to join the HSA over the next few weeks, and we think we have another 20. Like I said, another 10 that we have identified. Michelle was shared up with us this morning. So it's ongoing, but she has done a remarkable job in bringing on people. Public health needed a lot of assistance. They went from contact tracing, a few dozen people to thousands now.
Yes.
And they needed a lot of assistance, and they have been able to recruit, bring on persons who were unemployed, and we in the civil service has tried to do our best to take some of the non-medical work off of their shoulders. So, for example, they were people were calling them who were stuck in isolation for food, and that's not a public health function. So we have set up a separate system and separate number and separate call bank at our hazard management section. Big shout out to the Director of Hazard Management, Ms. Danny Coleman, who has been leading that for us with volunteers. We've had regiment, we've had the Red Cross come and man those phones, and every day we deliver groceries to our people who are stuck in quarantine and unable to help themselves.
Yes. Thank you very much. One of the things that we've been hearing is do not panic. We must take it easy. Everything's under control. And one of the key areas of crisis management is communication. And you mentioned earlier, communication is so important. Yeah. And that's one of the reasons why we're here. And I believe that communication right now is so important in the community to allay their fears. And that's why we're asking some of these questions. And we want to repeat it over and over, because if I don't know, and I might hear it, but I didn't catch it. And if I don't know, I'm going to worry. And so by hearing these things over and over from you and from other people, it's so important. So I encourage you and encourage government and everyone, try and communicate as effectively as possible. Don't resort to one platform, internet or online. You have to use everything. And so that it's important to get the message out. And we have to repeat it over and over again. That's how we learn. And so once we learn it and get a habit of being careful, we will get through this together. And we all want to, because we're on the same boat. We're in some rough water right now, but we can sail it through. And I look forward to the day when we will be back to normal, or in the new normal, where everyone is drinking soup and eating bread, as we say. But the communication is so important, and I encourage it. I had some concerns in the last couple of weeks as the numbers were climbing, but over time things settle down, and I'm seeing the trend is actually going down in the last couple of days, and we hope that trend continues, that the communication comes, because I'm a numbers guy and I look at numbers very closely. And so therefore, that is good to see the trend going that way, and we hope it will continue. But like you said earlier, we can't do it alone. We need everyone on board to do it, not only the government, but also the citizens and the private sector.
Absolutely. So yes, our numbers are high. We have a 10 a.m. sit-rep meeting every day to get our numbers, to see where we are. Are there any priorities that we need to deal with right away? Is it a policy change that we need? Do we need to move people around? So, we are on this every day, making sure that we are staying on top of things. We didn't just sort of develop a plan and then hope that it worked. So we are constantly getting the feedback, listening to our critics. We've had our critics. Some people haven't had a smooth experience with our travel portal. Others have been raving about it. We needed to tweak a few things, make it even better, and we're doing that. We're not resting on our laurels. But yes, and I think I need to say this again. If there was any doubt about the effectiveness of the vaccine, what we're seeing happening here now should show us and demonstrate, with 87% of the people in the hospital unvaccinated, that should tell us to go out and get your vaccine and get your booster if you can. That was an issue that was raised today, and I think it's worthwhile me saying it here. Ms. Yearwood raised it today. She is not very happy with the take up on the booster for persons over 60. The take up has not been as high as we would like. So I'll use this platform here this evening to say to persons over 60, get your booster. Get your booster shot. It is the best defense. His Excellency the Governor just came back from the UK, where he was given the latest information on COVID from the experts there. And I think it was Gibraltar or one of the other crown dependencies that have exceptionally high vaccination rate, but they're seeing rise in COVID. And it was simply because not everyone was taking the booster. So it is so very important that you take your booster when it's available. But if you're over 60, you should get it now. Do not wait until you get sick, or do not wait. Don't wait. Go and get it now. The HSA has the vaccine clinics. The governor's office is making sure that we never run out of vaccines, that the UK is always bringing them in for us. So that's my message, strong message this evening, especially those who are over 60, get your vaccine, get your booster.
Thank you, Ronald. I got my booster.
Good. So did I.
Not giving them my age. Mr. Roy.
Well, in times of challenge, I just want to say that I try to be a fair critic, and of course, I am on the side of the government in trying to contain this pandemic and trying to be, I am very sensitive to how much our economy depends on the global and international world. So I know that we had to open up at some time, but I am determined to remain vigilant. I have heard what the Deputy Governor said. I'm following the news with a keen interest. I just think that there are some areas that the government can make some improvements, and that is by providing regular information to the public. And we said on the panel before, why is the government not making greater use of, for example, Radio Cayman, government information service, to give out little bits of information? We don't have to wait until you are holding a press briefing. You could give synopses of very important messages that you would like the general public to be aware of before the press briefing. Because in any case, in the press briefing, a lot of valuable information cannot be digested because most people prefer bite-sized bits, for want of a better expression. And if there were more bite-sized bits, then we could perhaps do better than we are doing now. So that is one area, Honorable Deputy Governor, I want you to give an eye on to see if there cannot be any improvements. Okay. And another area that I'm not saying that there is now, but usually in these cases, the poorer class people gets left out. So if we could ensure that these people have access, particularly the people who are in the outlying districts, that all of those people have access to vaccinations, to the most updated information, to the lateral flow testing, and all that kind of stuff. Because it will take all of these strategies for us to come out of this exercise as successful as we would like. Other than that, I'm optimistic. I remain supportive of the government, and I am looking forward with interest to see what is going to happen when we finally open up, as I realize that we cannot continue to live in a cocoon, and the government cannot continue, great as they have done, given stipends that they've been given, because you cannot give out more than you're taking in for a very long time.
Thank you, Mr. Roy.
And by the way, I've had my booster. I've had the 2 shots. I've had my booster. And I encourage everyone, every responsible, right-thinking person. This is serious, and we have to support the government. We cannot allow ourselves to be hospitalized, to tax the system, because every bed taken up with a COVID patient is one bed less available to the person with a heart attack or a stroke or some other kind of serious illness.
Well said.
Thank you. And I take on board, sorry, your thoughts and suggestions. We have a really amazing comms team. Miss Onisha Richards is there. She's been doing a great job. We have Ms. Susan Ebanks there. They have a great team. The coronavirus website on gov.ky has so much information there. We have been doing some videos to push out, but listening to Mr. Borden, I think we're going to have to up our game a bit to make sure if he's not seeing some of the information that we're pushing out, then we need to be a bit more diverse in what we're doing.
And Mr.
I take the point very seriously about reaching our elderly as well.
And Mr. Madison, we have to remember, you know, that the little people out in Bordentown and East End and North Side, they're going to be listening to Radio Cayman because a lot of them are not online. I appreciate and know that a lot of the information can be gleaned in them. But when we talk about the people, the proverbial little man, their Radio Cayman is their avenue to the world.
Okay.
So that's where they're going to be looking for these things to come from.
Okay. In our last few minutes, we want to just touch on a topic that we spoke on briefly, and I think it's a good way to round out this conversation and put some confidence in our residents. And that's that Cayman has highly qualified individuals that work in our leadership roles and below. And we had the gentleman from Health City on, and recently Shamari Scott. Yes, and that was just one example. Another example is the deputy governor himself. And so I think that the country, can be comfortable that in our leadership roles in the government levels, in the private sector, there is a wealth of knowledge and expertise in our Caymanian people. Of course, we need to have a mixture, and some folks from overseas have come to join us, but there's also a lot of Caymanian people. And to emphasize the point Roy was making earlier, we do have resources here and people can do this job. And I think that we do have resources to take us through this pandemic, not only from a Caymanian side, but also from expat side. And we have a strong team in all areas of government and all the country and everywhere to really take us forward. And if we're able to accept criticism when it comes, and because we can't know everything. Right. And it's good when someone gives us some advice and we listen to it. You might take it right away, but we can take bits of pieces and we'll get the right solution at the end. But we have to be willing to listen to as much as we can and communicate as much as we can. And at this point, I want to give it some last words, Mr. Deputy Governor.
No, thank you, Mr. Lewis. And that you're right, sir. You hit the nail on the head. The key to our success has been our public service, our civil service, our private sector, all working together. I am very blessed. I say it all the time. I am surrounded by highly talented individuals who make my life easier every day by being dedicated, by being selfless, by going that extra mile and not settling for okay. We have set this very bold vision of being a world-class civil service. So we are not settling for things that are just okay. Our policies and procedures, the policies that we put out, it has to be to the highest standard. And I have people all around me who make sure that happens. And yes. the dedication, the commitment, the love for country, I have never seen it better than I've yes. seen it in the last, from March 2020 when we shut down until today. Yes. I have seen the very best of our people, our communities. And that's the reason why I am, like you, sir, very optimistic that we have this amazing opportunity to achieve something that few countries have been unable to achieve, and that is keeping deaths down and not having to shut down again. We have that amazing opportunity. It's going to mean the commitment of everyone in the Cayman Islands to do their part, to practice the safety measures, to listen to the advice of the medical professionals, abide by the policies of the government. We're all going to need to do that. But I do believe that this beautiful, beloved Cayman Islands can achieve something very, very special. And actually, that's exactly what we have been doing now for a long time.
And thank you very much. And to all our listeners and viewers, we thank the Deputy Governor, Mr. Manderson, for joining us today. As the reopening process unfolds, we'll be inviting other stakeholders to give an update on its progress within their related industries. Gentlemen, thank you for joining me. Have a pleasant good night. And to all listening, enjoy your night and stay safe. Thank you.
Thank you for having me. Thank you very much.